In the previous lecture, we learned how high blood pressure damages the blood vessels that subsequently damage the four main organs of our body, which are our brain, eyes, heart, and kidneys. Now let's see what are the consequences of these damaged organs. The brain obviously needs blood and oxygen to function. So if the blood vessels in the brain, they get clogged or burst even due to a aneurysm, then the brain cells of that particular part will die off, leading to stroke. The next most serious complication of hypertension is hypertensive retinopathy. Retina is the innermost layer of the eye, and pathy means disease. Normally, retina takes in the light and helps transmit that light as an image to the brain through optic nerve. Hypertensive retinopathy is classified into 4 grades, depending upon the changes seen in the fundus of the eye through fundoscopy. The fundus is the interior surface of the eye opposite to the lens, and it contains the retina, optic disc, which contains the optic nerve, retinal blood vessels. The arteries are the lighter ones and the darker ones are veins, and finally the dark spot, which is the macula and fovea, where the image is formed. In the normal fundus, optic disc margins are clear, retinal vessels are running smoothly away from each other, and there is no leakage or bleeding in the retina. In grade 1 hypertensive retinopathy, the blood vessels, they become tortuous with increased reflectiveness. You can appreciate this white or silver line in the vessel. This is termed as silver whiting. In grade 2 hypertensive retinopathy, there are grade 1 changes plus arteriovenous or AV nicking, which is a phenomenon where arteries and veins are seen crossing each other. In grade 3 hypertensive retinopathy, you will find grade 2 changes plus cotton wool spots, which are these white patches on the retina. They are caused by damage to the nerve fibers. You'll also see retinal hemorrhages, which are flame-shaped due to leakage of the blood vessels, and they can cause serious vision problems. Finally, in grade 4 hypertensive retinopathy, there are grade 3 changes plus papilledema, which means swelling of the optic disc. You can diagnose this on fundoscopy when the optic disc margins are not clear. Like if you see in this previous picture, you can clearly see the margins of the disc. However, in this one, the margins are blurred. This is due to raised intracranial pressure. It happens when the blood pressure is very high, and it should be treated promptly because the patient might lose vision permanently. When the blood pressure is high for a long period of time, the heart has to work harder to pump the blood, particularly the left ventricle, because it is the main pumping chamber of the heart. This causes increased muscle growth of the left ventricle, similarly like your biceps increase with lifting weights. Unfortunately, this change in shape of the heart muscle makes it less effective as a pump, causing heart failure. Left ventricular hypertrophy can be diagnosed on ECG. We look at the QRS complexes in the chest leads, particularly V1, V5, and V6. Now this is the normal ECG. In left ventricular hypertrophy, however, the QRS complexes in V1 are very deep, and in V5 and V6 they are very tall. The next most serious complication is coronary artery disease. We know that coronary arteries supply the myocardium with blood. So if these arteries are weakened or narrowed due to high blood pressure, then the blood supply to the heart is blocked and the heart cells die. This will cause myocardial infarction, also called heart attack. Hypertension also damages the kidneys. It is called hypertensive nephropathy. What happens that if the renal artery is clogged or weakened due to high blood pressure, the kidneys will receive less blood, and less blood means that they'll receive less oxygen. When the kidneys don't have enough oxygen, they'll not perform their functions well. But what is the function of the kidneys? To maintain the fluid balance in our body, right? So when the kidneys do not have enough blood, they'll think that they're dehydrated. So they'll try to compensate for it by activating the renin-angiotensin-aldosterone system in the kidneys. This system will increase the fluid in our body, further increasing the blood pressure. And this vicious cycle continues, causing further damage to the kidneys. Additionally, high blood pressure will damage the glomerulus, which is a small ball-shaped structure involved in the filtration of blood. It is one of the key structures that makes up the nephron, which is the functional unit of the kidney. The glomerular membrane is like a stainer. It holds the larger particles like albumin in the blood and let the smaller ones leak into the urine. But if it is damaged due to high blood pressure, then these larger particles will also leak into the urine. This is called protein urea or albumin urea. All patients with hypertension should see an ophthalmologist to get their eyes checked so we can rule out hypertensive retinopathy. We should also check their urine electrolytes to check for renal disease, urine dipstick to see if there is any protein urea, ECG to check for left ventricular hypertrophy. Also, we should check their lipid profile and HbA1c because hyperlipidemia and diabetes mellitus, along with hypertension, are additional risk factors for cardiovascular disease. These investigations should be done at diagnosis and then on an annual basis. That's it for today, guys. Thank you for watching the video. Take care. God bless you all.